NCLEX. Practice questions and tips. Can you answer this question? 2. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? A. Starting an IV. B. Applying oxygen. C. Obtaining blood gases. D. Medicating the client for pain. Answers is B. Applying oxygen. Tips. Treatment of burn shock. Treatment of burn shock in the pre-hospital setting should consist of elevating the patient legs 12 inches off the ground and administering humidified oxygen. If rescue personnel have advanced life support capability and transport time may be prolonged, these treatments are complemented by intravenous IV fluid administration. Fluid resuscitation need not be initiated if patient will be transported to the hospital in less than 30 minutes. When the transport time will be longer than 30 minutes, the indications for fluid resuscitation include thermal injuries involving greater than 20% of total body surface area (TBSA) and evidence of burn shock. Fluid resuscitation. Fluid administration should begin immediately with warmed fluid if possible. Catheters may be placed through burned skin if unburned skin is unavailable. If for access is not possible, interosseous access methods may be considered. This is important because any burn extending over more than 15% of TBSA may produce shock as a result of hypovolemia. 4. Fluid resuscitation is not recommended for children at the scene of the accident, because of the difficulties encountered in cannulating small veins. When fluid resuscitation is indicated in an adult, lactated Ringer solution or normal saline without glucose is administered, though a large bore percutaneous catheter, preferably inserted through unburned skin. The arm is the preferred site for cannulation. IV flow rates are determined according to the patient clinical status. Cooling of burn tissue. Remove charred clothing. Immerse the burn wound in cold 1-5 water for about 30 minutes if transport cannot be undertaken immediately. This must be initiated as soon as possible. Cooling has no therapeutic benefit if delayed more than 30 minutes after the burn injury. Do not use ice water, may worsen the damage to the skin as well as promote hypothermia. 5. Do not apply ice directly to the burn wound. This may result in increased tissue injury through frostbite. The beneficial effects of immediate cold water treatment of burned skin appear to be related to the following factors. Cold inhibits lactate production and acidosis, thereby promoting catecholamine function and cardiovascular homeostasis. Cold also inhibits burn-wound histamine release, which in turn blocks local and remote histamine-mediated increases in vascular permeability. This minimizes edema formation and intravascular volume losses. Finally, cold suppresses the production of thromboxane, implicated as the mediator of vascular occlusion and progressive dermal ischemia after burn injury. Local cooling of less than 9% of TBSA can be continued longer than 30 minutes to relieve pain. However, prolonged cooling of a larger TBSA can cause severe hypothermia, which may result in cardiac arrest. Prolonged irrigation with cool fluids or leaving the victim in wet sheets will not improve the burn and greatly increases the risk of hypothermia, as well as macerating the healthy tissue surrounding the burn. Burn victims often complain of feeling chilled as a result of the loss of water and heat through the burned skin. Heat loss can be minimized by first placing a clean sheet under the patient and then covering the patient with another clean sheet, followed by clean blankets. The inside of the transport vehicle should be heated enough to make the patient comfortable. The goal is to cool the burn wound but warm the patient. 4. Minor burns can be cooled with running tap water and dressed after more life-threatening issues have been addressed. It is important not to forget to provide the patient with adequate analgesia transfer to burn center if the vehicle with advanced life support capability can transport the burn patient to a specialized burn treatment facility within 30 minutes. The patient should be transferred directly to this facility, bypassing other hospitals. If the transport time to the specialized burn treatment facility is longer than 30 minutes, the patient should be transported instead to the nearest ED with advanced life support capability. Thanks for watching. Please subscribe. More nursing tips. NCLEX